Hello, welcome to the Style Life Innovators series. I'm Liz Landry, and today I'm really excited to interview Dr. Maria Sokolina. As the founder and CEO of Harmony Dental Arts, Dr. Sokolina is dedicated to creating a healthier world by promoting sound sleep and healthful breathing. Originally from Russia, Dr. Sokolina graduated from medical school with a dental degree and later earned her DDS degree from the New York University College of Dentistry. With extensive expertise in implants, cosmetic dentistry, full mouth rehabilitation, and orthodontics, Dr. Sokolina is also deeply involved in dental sleep medicine, focusing on innovative solutions for sleep apnea through dental appliances and myofunctional therapy. Welcome, Dr. Sokolina.
Good afternoon. Very honored to be here.
I am so happy that you're here. We have so much in common, and I'm excited to, get your opinions on these topics and what you are doing in your own practice and helping others learn about all of these different approaches that we really need to look at. So you've built your reputation in dental sleep medicine, but today you're also focused on the systemic effects of poor sleep and oral health. Can you tell us more about why you believe a systemic approach to dental care is so important?
I have a proof of that concept every single day when I meet my patients. And yes, one story when I meet my dental sleep patients, but in the same time when I meet my dental patients. And I know we ask about medical history, and as a student of science, I can't stop but wondering how come people who come to me in such a young age have so much on the medical history. And that would be very, repetitive cases, one after another. It would be allergy. And sometimes people said, I don't have allergy, but I just have seasonal allergy. Like seasonal allergy would be totally different story. So they have allergies, asthma. Very often in a very young age, I have people with diabetes and high blood pressure and atrial fibrillations. There are some other decoration of the medical history present as well, but that bouquet I get every day from dental or from sleep patients. Yes, a lot of things I see as a reflection of a disease in the mouth. So with experience, and I've been practicing for many, many years, I see that pattern.
Yes.
And yes, early on, I was wondering what's the, common, how this, keep happening with one and another and another and another patients, and they're all so young.
Yeah.
Then when I delve deeper in the dental sleep medicine, I find routes to roots. I find the reason why so many people are so sick and tired of being sick and tired. And that's actually evoked my interest towards dental care and systemic health. It's so sad what dentistry become separated from medicine 150 years ago, and insurance built on it, like we can talk about that for a long time. So this is just sad.
Yeah.
But being on outskirts of medicine, dentists actually have opportunity to be an observer or active helper to make people healthier. So that's the reason for my interest. What I see I cannot say very sick, but I see people with a deep, rich medical history. And towards as the year progress, I see how, then they become actually sick.
Right. Yes.
And
I was just going to say, as a hygienist of over 40 years, going through the decades, I saw a trend ongoing of more and more people, again, as you're saying, being younger and taking more and more medications, and more of them becoming diabetic at a very young age. And there was a trend that I noticed over the last 4 decades, and it's really pretty scary. And again, because we are, as you were saying, we have this opportunity in dentistry, since we see our patients more often than they generally see their physicians, we can really make an impact on helping them learn and giving them techniques and whatever we need to give them so they can improve their lives, but giving them that knowledge and then how to apply it.
Yeah, we have a totally unique position because number one, we see everything so close to our eyes. I can say 2.5 feet, so very close.
Yeah.
And number two, we spend the longest amount of time with the patients. And that often every 3 months, every 4 months, every 6 months, we're talking about periodontal health. And this, I would say points of contact on a regular basis create trust.
Yes, that
And
relate.
then
Hmm.
the relationship and somebody actually, listening to you, listening over and over and over, and maybe eventually, with the raindrops, you can form, or you can present something a little bit bigger than just, simple clinic or finding the cavity. So I believe in our profession, we should have much higher impact. And for that reason, I write about that on Forbes specifically, or I educate people through my channels on the social media, on the Facebook or YouTube. I try to connect systemic health and dental health in one unique circle.
Yeah, we need that all-encompassing approach for sure. Now, on that topic, mouth breathing has a significant impact on both oral health and sleep quality. So, how do you address the challenges of mouth breathing in your practice, and why is it so important for patients to switch to nasal breathing?
That's actually the topic what's been such an eye-opening for me with the mouth breathing. I was always wondering how come also very young people would come to me and I would see profuse bleeding in the front area of the mouth. And I would look at the gums and they don't look red. They look actually blue. And I can spray, the air and I can see the black tartar right there in the front. And it would be, you know, all six teeth, usually it's 60, six front teeth, top and bottom. And, that time when I graduated from dental school, nobody talk about, so specifically why mouth breathing affect that way. Now we know about the bacteria and we can do the saliva test. It's not visible here with the green screen, but we are big to find, the proof of mouth breathing. Another thing I want to mention to your audience, whenever I ask the patient, how do you breathe? People, the common 95% of time, they usually said, I don't know. People take breathing for granted.
Yeah.
So I don't know how I breathe, but I ask, do you keep a glass of water next to your bed? When you wake up at night, do you drink? So that means the mouth is dry. Most likely they breathe through the mouth, maybe at night, maybe during the day, to kind of bring self-awareness. So mouth breathing and specific bacteria. And then systemic effect, what we see on people who breathe through the mouth. Yes, I usually, when people breathe through the mouth, it's a great representation in the mouth. You can see that. You can see signs of a tongue thrust, open bite, crowding, because people use the cheeks and the lips to help them swallow because tongue is not on the roof of the mouth, so that whole position when they breathe through the mouth affect so many things, including sleep, including gingival health. And that's why, StellaLife come very handy with the wonderful elements of the products what can decrease that inflammation in the mouth and decrease the systemic inflammation because the level of inflammation for people who breathe through the mouth is much higher.
Right.
So, uh,
I think also
which
in talking about that, when we're talking about the tongue placement and all of that, because I've seen, that desiccated tissue from the mouth breathers, forever, as a hygienist, I'm seeing that all the time. But beyond that, the function and, the reasons they get there, whether it's some type of orthodontic treatment that didn't work or, at this point has relapsed, many things are going on. But I myself had the experience of having myofunctional therapy and have been teaching about that for a very long time. And it made a huge impact on us. So, if we can have these signs that we look for as you're educating doctors and teams to look at, and then have the resources to get them the help that they need, then we can really make a huge difference with them.
Absolutely. I just want to, going back to that question, it's really important on a gingival health and as well on the success of my sleep apnea treatment.
Yes.
We have to use that wonderful term, which I love and I never knew it exists. It's called nasal hygiene. I was always wondering, we as a dentist, as a hygienist, we're so big on a mouth hygiene, oral hygiene. People have to brush the teeth, they have to floss, but this is the opening and this is the opening as well.
Right, right.
And a lot of, we can call it flame, get accumulated in the nose. And I personally use the nasal rinse. I wash my nose whenever I brush my teeth. And I don't want to make your audience disgust, but I'm just wondering how come that stuff can stay in me through the whole day. And for some people who don't do that, it just stay forever.
Yeah.
When I see that in the sink, I'm just wondering, how come? It seems like I don't do anything terrible.
Yeah,
But I'm so happy.
after seeing an ENT for some ear issues, she told me that I should do that daily, and it's really changed my life. And it just feels amazing too. But yes, you see all this junk coming out, and it's like, wow, I'm sure glad I'm doing this now. So it's making a huge difference. So yes, all of these areas are areas of concern, and we can really help our patients understand that. And so with patients with periodontal issue, you've recently started offering more personalized care, which I think is great. We can't try to keep putting everybody into a box based on insurance. We have to really look at the risk factors. And salivary diagnostics is so important to that process. So tell us how the use of salivary testing has changed your approach to perio care.
This one, it's totally eye-opening because I'm a big, fan of periodontal therapy. And that's how I look at that. I said to my patients, look, if your gums are bleeding, that means it's just invitation for bacteria to get in. They form the little ulcers on the gum and they happily swimming inside your blood, inside your body. What are you waiting for? You need to really close this entrance, when we talk about periodontal therapy. But people come in that often, like every 3 to 4 months, and I cannot say they don't brush or floss. But for some people, they say, I brush and I floss. And I would say, maybe not enough. Maybe you have to do a little bit more. But then it's the same people over and over. And there are a lot of people who don't even know where the toothbrush is located. And the gum, they have a tartar, but gum doesn't bleed much.
They're fine. Yes, I see that. It's always been a puzzle. Yeah.
That's really surprising fact. And I start to connect the dots. And yes, and I'm offering them, scaling and root planning and irrigation. But I learn on, like conferences like AOSH, what we all have very unique composition of bacteria in the mouth. And probably the therapy we have to offer to the patients, like with the products like StellaLife or, some other therapy, have to be different based on the fact, for example, like we talked about on the previous question, mouth briefer or the nose briefer. That's going to be a different story for periodontal therapy. Or somebody who have periodontal disease running in the family, genetic predisposition would be very different from somebody who has a healthy, we can say healthy genes or not predisposed to periodontal infection. And that's really opened my eyes. I have to admit what I'm still learning, science is not a closed book, how I can personalize that treatment for people, for example, who don't want to have antibiotic prophylaxis. And how can I incorporate products like StellaLife with a probiotic? Like how can I form those therapy for certain groups of patients with a certain type of bacteria? Because of course, I don't want the mouth, my patient's mouth specifically, to be the entrance for a lot of bacteria, what can lead to systemic, very scary disease like cancer or Alzheimer.
Right.
I don't want that for my patients, and I don't want it for any people.
Right.
That's why we're doing what we're doing.
Exactly. It's all about controlling and changing that oral microbiome. But with the salivary diagnostics, we can check what their genotype is. Do they have a predisposition to an exaggerated inflammatory response? So that's going to change what we do. And then, of course, being able to use the probiotics, like the StellaLife has the gut and oral probiotic, which we've actually seen improvement in periodontal health simply with using that and providing the SRPs and the other, non-surgical therapeutic things that we can do. So it's a whole world of possibilities that's opening up. So I think the future is bright. And
Yes.
with doctors like yourself who appreciate and understand that, and we're all continuing to explore and educate ourselves, and then helping others by sharing that information. So thank you so much for spending some time with me today and talking to all of us about what you're doing and how we can again improve what we can do so together we can continue to improve people's lives because that's what it's all about, right? So
Fantastic. Yes,
thank
thank you
you.
very much. And I just want to mention what I have a little freebies for your audience, what people can do the self-assessment, how myofunctional therapy can improve the sleep, or if people have pain in the jaw joint, it's also I have a self-assessment and the videos after those self-assessments, what they can do complimentary. It doesn't cost you, but you get benefits of those exercise and you can improve your life and improve your breathing and hopefully have less um, systemic effect
Yes,
through your oral health.
Doctor, heal thyself, right? So we start with ourselves. We can help others more. And yes, we have those links there. So please take a look at that, everybody, so that we can again feel better ourselves and help our patients do the same. So thank you again, and thank you everybody for joining us today. And looking forward to seeing you at our next interview. Stay well, everybody.